pleasure to be here and also be audible on the webinar. So thank you so much to the National Center for Farmworker Health for inviting us to present our experiences with the National Diabetes Prevention Program and ways to engage, enroll, and retain participants in the CDC Lifestyle Change Program. So it's our pleasure to share these stories and experiences with you to make it happen. So this is me again on this slide. As Sylvia said, I work with the Association of Diabetes Care and Education Specialists, and so oversee our training and technology and technical assistance that we provide to help advance diabetes prevention across the country. I also provide oversight for our CDC Cooperative Agreement Award, which I actually have the number of this award. It's NU58DP006361. And I'm saying that number because my fellow presenters on this webinar, their work is supported by the Association of Diabetes Care and Education Specialists, but funded by the CDC. So although CDC provided this really important support, I just want to make clear that the content that you hear on today's webinar is solely the view of me and my colleagues and does not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. So we are sharing our own experiences with this program. So at the end of today's webinar, we hope that everyone who's here, whether you have that preliminary or fully recognized program or you're just getting started, you'll understand or kind of look at new ways to build a strong prevention team with the right lifestyle coaches for your community. Understand how to build awareness of the diabetes prevention program with your providers, your partners, and your patients or participants. Really identify those critical pieces of the program to drive enrollment, engagement, and retention. And then with my colleagues from Arizona and Oklahoma, you will be able to see these strategies in action and see people that are making this happen in the field in building successful programs. So I'm going to start with a really big picture view of the why behind diabetes prevention. And we're going to go way back. We're going to time travel back to the 90s and learn about the original research study that established the diabetes prevention program as the program that we know and love today. So this was happening again, back 1996 through 1999. They were working with 27 different clinical centers across the country, recruiting 3,000 participants. You know, this is a massive research project. And what's really great to kind of look back on is that they over-enrolled some of the populations that we're still concerned about today. So they over-enrolled seniors in the program. They over-enrolled women in the program. And they over-enrolled individuals from priority populations such as African Americans, Alaska Natives, Latinos, Asian American, and Pacific Islanders. So those, all a very diverse cohort of individuals was included in this group. All of the participants were overweight, all had impaired glucose tolerance, which we now call prediabetes. So back in this study, they divided people into 3 conditions. So some individuals got a placebo and brief lifestyle counseling. So basically a healthcare provider saying, you know, you should really lose some weight. You should exercise. You should be more physically active. So you should change your eating patterns. Some individuals got metformin, which was an off-label use of this medication for people with type 2 diabetes. And other individuals got one-on-one support from a healthcare professional, from a clinician that was focused on their losing 5 to 7% of their starting weight, improving their eating patterns, and making changes to their physical activity to achieve 150 minutes of physical activity a week. So what we learned from that study is that metformin did all right. It actually did end up preventing or delaying type 2 diabetes, but this intensive lifestyle change program was even more effective. So in the general population of the study participants, it reduced diabetes by 58%. It was even more effective for people who were over the age of 60. And when you looked over time, because now it's been quite some time since the 90s, even though that's hard to believe, it was still worked over time. So this weight that was lost, the increased physical activity, the changes to the eating patterns ended up reducing type 2 diabetes in the long run. I will note that metformin, again, this off-label use of metformin, was most effective with younger participants, women with a history of gestational diabetes, and those with higher BMIs. So you might be listening to this and say, like, that was great, but that sounds like a really expensive research project. And you are exactly right. It was a very expensive research project. So in order for this to become a public health intervention, they really needed to translate this research into something that we could all do realistically within our health centers, within our communities. So the first thing they said is, it's really, really challenging is that if we're doing this within research hospitals, it can be pretty expensive. So they moved it out into community settings like health centers, like health districts, like community-based organizations, like faith-based organizations that were much more efficient cost-wise than the big research hospital. They also realized that one-on-one interventions are pretty pricey. So they moved from a one-on-one format to a one-on-10 or a one-on-15 format. And that really brought the price down. And then they also realized that you didn't necessarily need an MD to deliver this program. And sometimes the MD wasn't even the best person to deliver the program, that you needed somebody that knew the community, understand the needs of the community, could relate and be responsive to the community. And if that individual had proper training in the CDC lifestyle change program, they were equally effective. So when you put all those three things together, it brought down the cost to a third of the cost of this original research study. They kept some things the same. They wanted to make sure, this is a program that would benefit everyone. I could go out here on, the streets around my apartment building and probably find 15 people that would benefit from this program. But they wanted to really keep the focus on those individuals with prediabetes, with overweight or obesity, that were most likely to tip into type 2 diabetes in the next 3 to 5 years. So they wanted to pick a very at-risk population that they were serving through this intensive intervention. They kept the duration at 12 months. They kept a really strong dose of the program. Sometimes in public health, we talk about the dose relationship, like how strong of a dose of the intervention you get. So they kept the dosage, the intensity very strong, that it would be this year-long program and you would get about 24 doses over the year, starting out with a really intensive part of the program and then going to a less intensive part. And they kept the outcomes on losing that weight, 5 to 7% of starting weight, increasing minutes of physical activity to get 150 minutes of physical activity, and making changes to eating patterns to support that weight loss. So this may sound like kind of an academic discussion of like, oh, translational research, it's so interesting. But actually, these are the same levers that you have today to make a more efficient program. So you want to really look, and especially those of you who are out there thinking about, well, we're at preliminary and we're trying to take it to full, or how can, we're doing the program, but we're still trying to get those efficiencies in the program. The first thing you want to look at is how many participants you're serving, because your costs are going to be pretty much the same whether you're having a meeting with 5 people, 10 people, or 15 people. And the closer you can get to serving that group of 15 people, you're going to make your program more effective. Locations. If you're doing it within the clinical setting, that's going to be more costly than going out to a location where people are already gathering. And your staffing. If you have a very medical model for your program where you have RDs or RNs delivering the program, that is going to be more costly than having community health workers deliver the program with the support of MDs and RNs and RDs who are part of your care team. And something that we've certainly learned during COVID-19 is changing up the delivery mode. I mean, we're experiencing a distance learning delivery mode right now. This is synchronous education that we are going through together. And this is much less costly than if we had to bring us all into the same room together. Another thing to keep in mind, and I know you heard on the last webinar, and for those of you who haven't listened to that one, that's a great one to check out, all about the CDC recognition levels. And just a reminder that all of those levels really align with that research, that the first one is about the duration and intensity of the program. The second one is about getting that group dynamic, getting people to come into the program. And the third one is all about the outcomes. So focusing on that weight loss and documenting of those minutes of physical activity. And we know that attendance, and you'll hear about some sites that have some really good attendance and retention figures, that attendance and retention fuels your health outcomes. So again, the more of that public health dose that you can give of the program, the greater your chance of getting those outcomes you're looking for. So how do you make it happen? Well, you really have to start. The heart of this program is the lifestyle coaches who that's really where the magic happens, right? Where the relationship between that lifestyle coach and that individual participant in the program, the ability of the lifestyle coach to take a group of 12 or 15 people and make it a cohesive team that's all working together, the lifestyle coach really, really matters. So when you're thinking about who your lifestyle coach is going to be, sometimes our initial lifestyle coach is, the person that's really passionate about the program, who's been, who is that RN or RD or MD who's been working in diabetes for a long time and brings this program to the clinic. But after the program gets established, you really want to think about who else you can bring on in your cadre of coaches. So these could be frontline clinic personnel, medical assistants, community health workers, or health promoters. If you're working with a faith-based organization or you're partnering with a church or temple or mosque, these could be members of like the health ministry, volunteers, past participants. You really want to think about someone who knows the community, who's trusted within the community, and then they can learn that content. So, the training is really important, but having someone who has that community trust and connection is really where you start with lifestyle coaches. So you can't do a program with a lifestyle coach alone. A good team has a lifestyle coach or coaches. They have somebody who has an eye on the data that's really looking and seeing how the program's doing. They have a program coordinator that kind of is putting all the pieces together. They're like, okay, do people in the community know about this? I gotta tell my providers that we have this new program going on. Maybe I'll make a partnership in the community. I'm going to go talk at the local Lions Club and tell them all about, my diabetes prevention program. So that person is really the center of the team of really making sure that the coaches are doing all right, the data looks good, and that they're building those larger community clinic connections. It is true that sometimes when you get a program started, it is just you are the team. There's no I in team, but there is a me in team, and sometimes that's just you. Maybe it is just you on this webinar today, and you're kind of looking around like, where's my team? Where's the person that's going to do data? Where is my program coordinator who's going to build these magical connections? It is absolutely fine to start one of these programs with super strong, passionate person. But then you want to think about, as you go into the first year or year and a half, how you can start that to build that really strong team around your program. Building awareness is super, super key. I sometimes call this like the world's hardest 4-piece puzzle because this puzzle really encapsulates all of the challenges of activating a diabetes prevention program. So, if you start up here on the upper right, we're going to hear about some quality programs on this webinar. You probably have a quality program at your site, or you're thinking about building a quality program. But building a quality program is not enough. It is not like a field of dreams. Like if you build it, they will come. Like you just have to start your program and people are going to like drive towards your location and sign up. We know that we really need to have demand from participants that are like, yeah, I'm really interested in this program. I want to focus on my eating patterns. I want to get more physical activity. My doctor told me that I have prediabetes, and my doctor said that I should work on these things, and he recommended this program. So we know that not only do we have to increase demand for participants, but we have to let clinicians know so they can talk to their patients about this program. We know that when someone's doctor says, hey, you should check out this program, or someone's nurse practitioner or physician assistant, lets them know that there's this program going on in their community, they're more likely to join. We also know that awareness is key because there's not a lot of awareness out there. There's a lot of prediabetes out there. There's 88 million American adults who have prediabetes, but 8 in 10 don't know it. We have to start getting these messages out. This is part of CDC's campaign that 1 in 3 adults has prediabetes, so kind of like, here are these 3 people enjoying the park, walking their dogs and cats, jogging their dogs and cats, and 1 out of 3 of these people has prediabetes. So encouraging people to find out this information, to have conversations with their healthcare providers makes a big difference. And I always like this, I kind of think like a marketer on this part of like, you have to get people aware and interested so they can take action to sign up for the group. I really like these arrows across the bottom though, because that's exactly the journey you have to take people on. 8 out of 10 people are out there totally unaware of prediabetes, totally unaware they're at risk. You have to make them aware of that issue. Like, oh, do you have a family history of diabetes? Did you have gestational diabetes during your past pregnancy? Are you mostly like inactive during your week? So it's like, oh yeah, I have prediabetes. Then they have to be aware that this lifestyle change program exists. And then they have to be aware that your clinic or your community-based organization is offering it. And that is like really where the whole journey you kind of have to take people on, from like not really knowing anything about this topic to knowing that there's a solution that's available, and it's available in their community, and it's happening Tuesday nights at 7:00 and they can sign up. So that's the whole journey you have to take participants on. I sometimes talk about like on-ramps to the national DPP because, it's really hard for somebody that's just, out there living their life with prediabetes to, on a Tuesday, sign up for a 12-month intensive lifestyle change program. It's much easier to kind of tip people into that program that are already doing something to improve their health. Cynthia actually is going to talk about how they leveraged an existing program, an existing support group program that led to a very strong launch for their diabetes prevention program. So think about the other programs that are going on in your health center. Do you have fitness classes? Do you have walking or wellness programs? Do you have another issue support group or a chronic disease self-management program for a related or adjacent health issue? Tipping those people into a 12-month lifestyle change program is going to be a lot easier than like taking someone who picked up a flyer and tipping them into your program. And they also provide support for people coming off of your 12-month lifestyle change program. So after your program ends, you could be like, hey, stay active with Zumba and keep them going. Lots of things you can do to encourage participation in the group: meeting one-on-one with participants, encouraging these trust building activities, bringing in groups together. If you have 15 strangers, maybe it's making some teams or making some partnerships or trios. Really reinforcing this growth mindset, like we're all learning together, this is fun. Maybe you've added some friendly competition into your program. And considering, if you're doing most of the things online because of COVID-19, considering how you can include some low risk hybrid activities or online activities, even if it's just having everyone come out to a park, for a socially distanced walk, or you have a location that allows for like spacing for people to be physically active together. That's great. And you certainly want to look for those sticky environments where people are already going at least once a week. You know, most people go to their church or faith community once a week. I tend to go to work more than once a week. Like, but I am here at least once a week. Congregate meal sites, senior centers, these civic organizations, support groups, those are all really great examples. And again, retention really matters. The more of this program they get exposed to, the more their chances of achieving those weight loss goals and achieving the other health goals that you want to see as well. So some things that we took away from our experience doing our CDC cooperative agreement were using these orientation sessions, these lunch and learns to build awareness, incentivizing that dose of 24 sessions over the year, planning for makeups and kind of watching for any missed sessions, keeping an eye on our data. That's something that your data person can do, making sure that you're getting those minutes of physical activity and those weight checks, keeping an eye on 2% weight loss, or I'm sorry, 3% weight loss at 3 months, and keeping your programs going. If you only offer one program a year, it's going to be hard to kind of progress on your recognition and progress to a sustainable program. So now this is the most exciting part of the webinar for me, is that I get to hear from some people that are actually activating these learnings like within their communities. So I am going to turn it over to Cynthia Espinoza from Yuma County Public Health Services District.
Okay, can you hear me? Can you hear me?
Yeah,
okay.
We can hear you.
Thank you. Well, thank you so much. It is a pleasure to present. Thank you for inviting us. My name is Cynthia Espinoza, and I'm the coordinator of the Diabetes and Chronic Disease Prevention Program at Yuma County Public Health Services District. Yuma County is in the southwestern corner of the state of Arizona. It has a year-round population of approximately 200,000 residents, which consists of 60% Hispanics and around 36% white non-Hispanic community. 1 out of 4 of our residents were born outside the United States. And just as a fun fact, during the winter, we receive around 80,000 visitors. The Yuma County Health Department provides services that helps prevent epidemics and spread disease, promote and encourage healthy behaviors, and ensure accessibility of health services. Diabetes prevalence in Yuma is 13.1%, which is above the state average. The health department efforts to continue to work with chronic disease start back in 2013. When we got the CDSME license through Stanford Self-Management Resource Center. In 2014, the health department received ADCES accreditation for our diabetes self-management education program. We renewed our license last year for an additional 5 years, and we are the only accredited health district in the state of Arizona. As of 2019, a staff dedicated to this program was assigned to other health district programs, but assisted with the diabetes program. Last year, our agency was awarded diabetes-related grants that contributed to develop the diabetes and chronic disease prevention program with assigned staff. The grants allowed our agency to focus on capacity building, program implementation, and diabetes education. Our team consists of a program coordinator who is also a lifestyle coach, and as Angela was saying before at the beginning, one person was wearing different hats. Right now, the coordinator is also in charge of establishing and organizing the program, networking with agency, data collection, and promotion to community and providers. We started diabetes prevention and chronic disease program with 4 bilingual lifestyle coaches, which is myself, 2 health educators, and a registered nurse. Due to the positive response we got from our community, we were able to train 2 additional bilingual lifestyle coaches, which brings our team to 6 lifestyle coaches. During the month of September of 2019, the program launched the first cohort in an established support group for Hispanic women. Throughout the first 6 months, we met in person. Since it was already an established group and they already have a place and time to meet twice a week, the lifestyle coach met them there. So I think an important key for retention was that we didn't change the participants' environment, but the lifestyle coach adapt to their schedule. We tried to make the sessions interactive. If the lesson was about physical activity, we dedicated some time during that session to practice physical activity like marching on their place or a little dance. Or if the session was about the stress management, the lifestyle coach dedicated time to practice relaxation techniques. Just by the end of the core phase, so after the first 6 months, we had our first COVID case here in Yuma. So by following CDC guidelines, we had to stop the in-person sessions and convert it to a virtual program. We had a few challenges at the beginning. However, we successfully completed the one-year cohort with a great outcome. The group showed engagement throughout the whole year. By the end of the program, between the 12 active participants that completed the whole year program, they lost 96 pounds and increased their physical activity to an average of 250 minutes per week. A participant who lost 10 pounds, which was 5.7% of her initial weight, and increased her physical activity from 150 minutes per week to 300 minutes per week. Just by those changes, her A1C decreased from 6, which was at the beginning of the program, to 5.5, which removed her from the prediabetes range. A surprise benefit that I didn't think about when we started this program, it was how the program not only benefits participants, but it goes beyond and it can impact people around the participants. The participants I was talking about reported her husband lost also 20 pounds just by following his wife's new lifestyle. So he wasn't a part of the program, but he was following what she was doing. Another participant also mentioned that her husband lost 50 pounds and her son lost 12 pounds. Some key points that I can highlight from our experience is the importance to meet people where they are. Showing empathy and provide individual support between sessions is essential. The current situation, COVID-19, brought us some challenges. When we had to convert the in-person cohort to virtual learning, it was a challenge not only for participants, but also for the lifestyle coaches. We didn't know how we were going to deliver the first virtual session, but we knew to keep the participants' engagement, that session had to be delivered. The already established group, had already a Facebook page. So for the first virtual patient, what the lifestyle coach did was she recorded herself live and posted that on their Facebook group page. So that was the first virtual session. For the following sessions, the lifestyle coaches became more familiar with the Zoom platform and sessions were delivered via that virtual tool. For participants that did not feel comfortable using technology, the lifestyle coaches made themselves available to do one-on-one sessions through phone calls to guide them on how to utilize the virtual tool. In the meanwhile, the lifestyle coaches offer also makeup sessions through phone calls. And that brings me to my other point, which is the importance of being flexible. It is vital to show flexibility and empathy to our participants. At this moment, we have 3 virtual cohorts that we secure by working through collaboration with another organization. So that group, we divided into 3 different days and times to accommodate to the participants' needs. We offer the same session throughout the week. So if a participant cannot attend the Monday Spanish class, they still have the opportunity to attend the Tuesday English class or the Wednesday Spanish class. COVID-19 brought us challenges in promotion and enrollment. Our program staff explore different strategies to overcome these challenges. Our agency's health educators are helping with us with contact tracing. So, in part of the assessment they conduct while they call the patient include questions on chronic disease. So when an investigator go through the questions, they let know the patient about the programs offered to help them stay healthy, including the diabetes prevention program. That has helped us increase awareness of the program here in our community. Also, the 3 cohorts that we have in place originally as a result of collaboration with the Worksite Wellness Program from a nonprofit organization who was willing to target their employees. Another strategy that we utilize to recruit participants is collaborating with our internal programs by wrapping around referrals for community to take advantage of the educational programs offered here at our agency. If I could share something that I have learned through this pandemic, is the importance to explore all possibilities. Don't give up before trying. Work on strategies and implement them. This is totally worth it. And I say it, it is. Just seeing how people change their life and being part of it by supporting those changes is a great, great feeling. Thank you.
Great. Thank you so much, Cynthia. And we will have time for questions at the end. So if you have any questions, you can go ahead and write those down in the question panel or in the chat pane, and we will get to them later. So thank you so much. And now we're going to hear a perspective from another one of our sites in Oklahoma City, Oklahoma. So it's my pleasure to introduce Juliana Reyes.
Hello. So I'm Juliana Reyes. I'm trying to get my video started, but it won't let me. So I am the Director of Health and Wellness Programs at the Latino Community Development Agency here in Oklahoma City. And I'll tell you guys a little bit about our agency. So we are a nonprofit community-based organization in Oklahoma City. And next year, we're actually going to celebrate our 30th year here. Our mission is to improve the quality of life of the Latinos in Oklahoma City through education, leadership, services, and advocacy. And in total, we have 22 different programs in our agency. You would think that we're huge, but we're actually pretty small. And it's divided into 4 different pillars is what we call. One of them is Early Childhood Development Center, which is education. The other one is prevention, which is child abuse prevention and child and youth services. We also have the other pillar that we name oh, now I can get my video, sorry. Okay, and the other one is what we call treatment, which that one has all of our counseling services and substance abuse services, and then mine, which is the health area. Most of what we do is public health. So we have nutrition, we have immunization, breast cancer early detection, and HIV and STD programs. Most of the clients that we do see that come through our door are low economic status. They're or underinsured, and they are Spanish speakers. We do have a really high prevalence of prediabetes in Oklahoma. We're actually at the 7th top, and we're 2.4% above the national average. And most of the clients that we do see are Mexican, which is good because that they have a higher prevalence of prediabetes between the Latino community, but the Latino community, but the majority is Mexican, Central American, and Puerto Ricans. So let me tell you a little bit about our team. So it's 3 people. It's me and 2 lifestyle coaches. I take care of all of the health related programs, including diabetes prevention programs. So I work as also the program coordinator. I oversee everything and make sure that we're complying with everything. If we're needing a new recruitment, I help with that. Partnerships, which are super important in this program. And then my 2 lifestyle coaches. One of them, he's a medical doctor from Honduras, and the other one, she's actually an engineer, but she's been working with with health related programs for 25 years. And these are my lifestyle coaches are people that the community knows. They've been working with us for over 10 years, and they're very trusted within the community. Here you can see a picture of my team. It's me and the two of them, and that's actually one of the best things that you can do is form a great team where it's all cohesive and we work together. So everything is working, and we have shared communication. So everything is whatever Janity does, I know and Celia knows, and we make sure that everything is working together, especially right now with the COVID crisis. So our successes, in total, we have already enrolled 121 participants. We do have a really high retention rate. We usually have a 94% in the 9 core sessions and 91% in the 3 CAT sessions. In total, so far, we've had a 9.4% weight loss. It's a lot higher than we anticipated. We were expecting 5%, but our hard work actually has shown that 9.4% is what our participants have been able to lose. And we have received full recognition. We are fully recognized by the CDC, and we've had that for since we have the program for 3 years now. So we've been fully recognized for 2 years now. So how do we do it? This is like the main question and everything. We do recruit through anywhere you can imagine. We do outreach anywhere, but right now with the COVID crisis, we have been having to find innovative ways. So we have started a partnership with the county health department in Cleveland County. We already have one here in Oklahoma County, but Cleveland County is an area we haven't gone into yet. And once we're able to do in-person, smaller environment, we're starting to do classes over there at their building. Health fairs, we used to have just a big health fair, just a one-time a year health fair, but since we can't right now, we actually divided it into mini health fairs. We have one every month. We invite we have limited amount of people that are able to come in the building at a time. And with those mini health fairs, we're able to provide glucose, cholesterol, triglycerides, blood pressure, BMI. There's also a nurse practitioner that's in site. So most of free clinics here in Oklahoma have actually closed because of the COVID crisis. So she's able to help the people that used to go to the free clinics. And any testing they do, we partner with Integris to be able to get that. And then we also provide flu shots just to get people in the door to be able to tell them about our program. And then through everything that we do and just the nutrition programs that we have, all the prevention services that we have actually recently started a partnership with Yuma, and that has leveraged the rest of our programs just because we already do most of that work. So some of the things that we do for our classes and what keeps our retention rates high, I would say like some of it is friendly competition. Hispanics are notorious for being competitive. And some of the things we do is like, who has the most physical activity minutes, who has who brings in the healthiest recipe, who has lost the most weight, just little mini competitions. And also we do before and after pictures. And we started that actually this year because of the COVID crisis and because everything that's happening. But they've really enjoyed just seeing how much their body has changed just from whenever they started the classes to like a couple of weeks or 6 months. We do 3 months, 6 months, and a year. Incentives, we do that in every class. Incentives, they can be something as big as a yoga mat or as small as a recipe, a new recipe that they have. We do receive recipe calendars from Noni, and we give those out in the classes. Every class will give something just to keep people coming in, and it's related to whatever the class we're giving that week. And then we do raffles, bigger items like free YMCA memberships and stuff like that. We do that mainly at the end of the programs, and the ones that qualify for the raffle is everyone that has fulfilled all of the requirements, who have lost the weight, who kept their physical activity up, who has maintained a healthy lifestyle. So which pretty much is all of her participants. They all go into the raffle just because we don't have the money to give everybody YMCA memberships and all that. Due to the COVID crisis, we have been able to partner with different, I guess we've been able to do different partnerships than we normally do. Zumba has been a great partner for us just because they have the gym. In our building, we don't have a gym big enough to be able to comply with CDC guidelines. And online classes was becoming an issue for us, for the Hispanic community. Just some of our clients didn't have internet at home, didn't have how to access our program. So we partner with the Zumba classes that are offered in a really fairly decent sized gym, and we're able to comply with CDC guidelines, and we started doing in person again, thanks to the Zumba partnerships. And plus they get to enjoy Zumba, so it's also a great way to retain your participants and have that really big weight loss. And what we also do is we leverage with different programs that we already have. So we do have a program from Unidos US, which is Comprando Rico y Sano, which is a nutrition program that's also tied to SNAP enrollments, cooking demonstrations, grocery store tours. And with that program, we teach people how to make, like how to go grocery shopping for their entire family with $5. And that's at the end of the program, we usually give them a $5 gift card and take them to the grocery store and see how they buy a whole entire meal for their family for less than $5. And we incorporate some of that also into our diabetes prevention program. So it's all integrated. Some of the advice that I would say to someone that's starting, because it's a lot harder when you're starting. So it is a lot of hard work at the beginning, but then after a while, after everyone starts to get to know you, starts to see the difference, just getting full recognition, just having that, I guess people are knowing your program, the participants, they tell their neighbors, their family members about the program. So it really becomes easier just to get people into the door, people knowing about your program, and just knowing that, you know, this program isn't just helping one person, you're helping an entire community.
Great. Thank you so much, both of you, for sharing your stories. And before we start our discussion, I did want to put my contact information up on the screen. If you have questions or comments or thoughts, you can certainly share them today. But I know that sometimes I have the best questions after the webinar. So if you have any questions after that, either for me or my co-presenters, you can always send them to me or to our team email address, which is dpp@adces.org. And we are always happy to help. So wherever you are on your journey toward becoming a fully CDC recognized lifestyle change program, just feel free to give us a call, send us an email, and I will be happy to pass along any questions that you have to my co-presenters as well. So thank you so much.